Hey, Rob Rothrock with Safe Retirements Group, and today I want to talk about healthcare expenses in retirement. This is a big concern for a lot of people and totally understandable. I mean, with the way health insurance expenses have been far outpacing inflation, it's no wonder. So you may be wondering, well, my gosh, I'm paying for some of my employer's sponsored insurance now, and that's already $500 or $600 a month. Well, what's it going to be 10, 15, 20 years from now? Heck, what's it going to be 5 years from now? Well, we've got some good news, and the good news is Medicare is much more stable. Medicare Part B premiums in 2019 are $135.50 a month. Now, that they're going to be higher if your incomes, if you're 85,000 or more in income as a single filer, or 170,000 or more in income jointly, married filing jointly, they will be higher. But the first level above that still keeps them under $200 a month. Now, Medicare doesn't cover everything, but that's why you might want to buy a Medicare supplement that generally is going to run about $100 to $125 a month on top of the Medicare Part B premium. And it depends on where you live, and there's a few other factors, but for the most part, that's about right. And the national average on a prescription plan is it's $35 a month. So you add all those together, it's under $300 a month. So if you extrapolate $300 a month over a year, it's $3,600 a year, $36,000 over 10 years, or about $105,000 to $110,000 over a 30-year period. We have to account for inflation. Those are in today's dollars. It will go up gradually, but the Medicare Part B premium of $135.50, it's only gone up $25 over the last 10 years total. So very, very predictable increases. That's the main thing. Once you're on Medicare, we can now forecast pretty accurately what your healthcare premium expenses are going to be. So that should give you a little bit of peace of mind. And being able to forecast is obviously very important for planning. Now, what kind of coverage does that give you? Well, probably a whole lot better than you probably think. So $185 annual deductible is what you'll have on Medicare. And so you could have, heaven forbid, but you could have a 2 or 3 week hospital stay, open heart surgery, $300,000 in medical bills, and at the end of the day, only pay $185 of that. And some people are just shocked when they find this out. But so that is the good news. Now, what is some not so good news? The X factor of expenses for healthcare expenses in retirement are prescription drugs. Medicare drug plans are typically built to cover about 75% of name brand costs. Sometimes it'll cover 100% of generics, but if you're taking 1 or 2 really expensive medicines, then that could easily double your Medicare, your healthcare costs. Now, there are some caps and some relief once you get above a certain level to where you could only pay 5% of the cost instead of 25%. But anything you can do to get some assistance from a manufacturer, maybe get a sample from your doctor 1 month, maybe you can avoid a copay here or there in that situation. Or if you're on group coverage now and you have the option of keeping it and you may be getting a really good copay on that medicine, it might behoove you to stay on that plan as long as possible before going on to Medicare. And that's a decision we can help you make. And it is definitely case by case with prescriptions being an X factor. I know there's a lot of talk about reducing those costs. There have been for a long time, and so who knows what's going to happen in the future. There's also a lot of talk about Medicare and how solvent Medicare is going to be, and there's talk about Medicare for all, and how's that going to shape. Well, it's really kind of, we don't want to do any kind of forecasting on what might happen. That's just pure speculation. I'm pretty confident that Medicare is going to be there in some form or another. There's too many people on it not to be. So, but knowing we can at least forecast what your premium is going to be, and that can really assist and hopefully give you some peace of mind that, hey, it's really not going to be as bad as you think it's going to be. Word about long-term care. Medicare does not cover long-term care. We have a whole nother video on ways you can address potential long-term care expenses. But generally you can, in some cases, get up to the first 100 days covered, but beyond that, it's a whole nother issue there. And dental as well. Medicare does not cover dental, so you might look at getting a dental plan, but if you have some major work, it's only going to cover a portion of that as well. So that's really it for today. If you have any other questions or you want to go over your specific situation as it pertains to Medicare premiums, comparing your current coverage with Medicare, and know that when you're 65 is when you can get on the Medicare, give us a call. We'd be happy to go over that with you in more detail. And that's it for today. Thanks a lot.